So I do a lot of my work one-on-one. But I will, if it's something where I need the family to know how to support this person, then I'll, invite the client to invite their family or their friends or whoever is important to them into the session so they can learn a little bit about where we're going. Sometimes if we're working on like insomnia and there's not a whole lot of really vulnerable pieces, I'll just ask the spouse. Just bring your spouse if you want. Just bring your spouse in every single time so they can understand this change, because it might be a little bit odd. Like if I'm saying you've got to make sure you stay up till a certain time and your spouse always wants you to go to bed with them, but you're a night owl, and I'm saying you need to stay up 2 hours later, well, that can cause some strife in the marriage. I don't want that to happen. So sometimes it's just like you just come into session. But, other times I talk about not everybody in your life is going to be able to offer the same degree of support. And I use the analogy of shoes. I learned this from one of my friends in Florida when she was preaching one day, and she talked about how there's different types of shoes, right? So like you and I have got flats on, you've got boots on, you've got peep-toed boots on, sandals, and so not every shoe is designed to weather every season of life, and not every shoe has the same degree of support, right? So depending on what you need, if I know you are a certain type of shoe, and I know that you're like a hiking boot, and you can really weather some tough storms, I might go to this person in my life because I know they're more resilient, they have more of an ability to support me. But I probably wouldn't maybe go to this type of shoe if I wanted to wear a sandal and I just wanted to go have fun and have some airy stuff, because I just know by nature maybe we go a little bit more in depth with life. Yeah. So I try to just use the analogy of shoes a lot, that you don't have just one pair of shoes in your closet, most likely. You pick and choose what you're going to wear on your feet based on what level of support and activity you need, what you're going to be doing.